Hello, everyone, and welcome to a live stream of the Aging Together podcast, Season 4, sponsored by Heart Mobility, revolutionizing those steel metal grate grab bars from the 1960s with their newest product, Safety Grip. If you're tuning in live, please use the chat to introduce yourselves and ask any questions along the way. Our guest today will answer them at the end of the show. So today's guest, we have Miss Arvette Reid, AIF. Arvette is a healthcare planning strategist in the Virginia office of Signature Estate and Investment Advisors, SEIA, and she works in the practice's Life Care Affordability Plan service. She joined SEIA in 2017 after 15 years as a marketing professional in the senior housing and healthcare industry, where her tenure spanned a range of independent living, assisted living, memory care, nursing care, and hospice care. Arvette's deep commitment to civic engagement and local issues was established as a youth while visiting residents at Goodwin Living in her hometown of Alexandria, Virginia. Arvette most recently served on the boards of the Insight Memory Care Center and Senior Services of Alexandria and is an active member of Jack and Jill of America, Incorporated. She holds a Series 65 securities license, a life and health insurance license, and she is an accredited investment fiduciary AIF professional. Her ability to bridge the financial and healthcare worlds together truly makes a powerful impact on how families who are going through trying times are holistically served. Arvette, thank you so much for joining me today.
Thank you for having me. I'm very excited to be here.
What a phenomenal background leading up to what you do today. We have so much to talk about, and I want to make sure we get to as much of it as possible. So I'm thinking we start with your background and your years in elder care, and then maybe you can share about your personal experiences and how that led to what you do today. So let's start with your background. What's your story?
Yeah, it's so funny when I tell my story. So you mentioned I'm born and raised in Alexandria, Virginia, and I actually went to the University of Virginia and majored in electrical engineering, right? And you're like, why does that matter? The reason is I spent 10 years working in software doing global marketing and management, but always in like the sales and marketing arena. So I built new services. That was my job for most of those years. And like so many during that time, you just kind of got burnt out. I was traveling a lot. I had just gotten married. We were talking about a family. And I was always comfortable with people's grandparents, my own grandparents, my friends' grandparents. I was never afraid of going to the hospital to visit people or the local retirement community. So that's when I decided to switch and work in that environment. So that's why I spent 15 years working with older adults and their families in the independent, assisted, memory care, nursing care, and hospice care. I was the one talking with families trying to figure out how to navigate the huge maze of options that people have when they're making the decision. So I did that for 15 years. And then after that, the partner that I worked for at SEIA, his name is Tom West, we knew each kind of people in common. And he was the first person that said, hey, the financial team, the financial advisors, the financial professional, they're not really trained to help this population of people. And so can you join the practice and help build something? And I was like, okay, so that's what I did. And I've been doing it for 8 years. And I'm so proud of what we have put together. And that engineering brain and process is in action every day with our clients and things like that. But the other part of that from a personal standpoint is right after I started the new job. My mother was a social worker for 26 years and my father was a middle school principal. So we didn't talk about finances. And right after I started a new job, my mom got sick. And she had a surgery that went bad and she died 18 months later. So at that time, I knew senior housing and healthcare. I was part of this industry. I knew all the things and all the options for her at that point. But the financial side was a big blur. And here, fortunately, the university had put me in the position where I now had Tom to guide me, my dad, my brother, and my aunt, who's very close to my mom, through this financial conversation as we were going through the healthcare journey. So I tell people when I'm talking to you, I'm a financial professional. I am also a senior housing and healthcare professional. But most importantly, I'm an adult daughter who had to walk through this with my family, as well as with my father-in-law, my husband's dad. So I really do believe that this intersection of conversations between healthcare and finance is where I'm supposed to be. And I'm super excited that we've built this language that we can share.
Yeah, it is so important. When I first talk to families about, what are their plans for aging? What are their plans for care, long-term care, end of life, and retirement too. And people immediately think about finances. And I really try to focus on the non-financial aspects
Right.
of stuff, right? Like, no, I meant like, what are you going to do? Right? Like, not financially, but finances are such a big part of it, right? Because depending on your income levels, what access you have to different federal or state level resources,
Yep.
what access you have to family support, all of that is dependent based on what you want and need, right? And so walk
Yeah.
me through walk us through your process, sort of how do you bridge these two sides? What is a typical day look like? Like what is it?
Was the conversation. So yeah, most people already have a relationship with some kind of financial profession in their life. That usually starts hopefully at a younger age where maybe you were talking to them about, do you need to save for college and sending your kids to school or putting an addition on your house or something like that. And then there's the conversation about retirement. How much do you want to spend on retirement? Where do you plan to stay in your house, or are you moving? Those kind of conversations. And then they skip right to, when you die, like, who are your beneficiaries? And traditionally, financial people skip right over the between retirement and death, right? But that's when all the healthcare stuff happens. So that's the exact point you just referenced. Like, so now you've got somebody in their post-retirement years, they've got a hospitalization for whatever reason, and you're ready to talk to them about what do you want to do, but they've only been trained to think about the financial side, right? And so this idea of all of the care options that people have to understand, nobody understands those in advance. They wait until it's time, and then all these options are thrown at them, and it's very confusing. So one of the most important things is when they come to us kind of in this crisis, and they come to us because we know we need to do something and we don't know if we can afford it. That's typically it. They're ready to jump right in the numbers because I'm a financial professional. But I stop them in their tracks because you are absolutely correct. The finances shouldn't be the thing that makes the decision. The what are you most hopeful for based on your current circumstance from a healthcare and housing perspective, that should drive the discussion and the decision. So when people come to us from like a financial conversation, I actually switch it to a care and housing conversation first and ask all those questions and make them think it through. And then we'll get to the finances. But it's really important to start with the other stuff first, right?
Yes.
And it doesn't matter how much money you have. Like, I'll tell people, you can have somebody who has $200,000 in assets. You can have somebody that has $20 million in assets. They're all freaking out about the same thing. They don't know what they want. Mm-hmm. They don't know how much it's going to cost. And they don't know how their family is going to get their head around all of it.
Yeah, I love that you do that. That's often my first initial step is like when people are like, they want to talk about the money. And I'm like, well, we can't talk about the money until we know what we're planning for. Right? Like, if I don't know if you want to age and die in your home versus, moving or transitioning into an assisted living or a nursing facility, we can't plan financially, right? Because all of that costs very different.
Yeah.
And it also depends on how many years you're planning for, right? Like if you're planning up to death, that's a very long-term financial planning situation. Versus if you're planning for, maybe the last 5 to 10 years of living in a nursing facility or an assisted living once you feel like you can no longer take care of yourself, right? So you have to think about all of that stuff. You have to think about, what is it that you truly want and how do we factor that in? I mean, I even touch on things like, are you going to be traveling a lot? Are you going to be like doing this? All of that's going to tap into what level of care you need and want in your final years, right? And so I love that you're including that in your conversations because a lot of times I meet with financial advisors and planners who tell me like, that's why they're coming to me. They're like, hey, we need to talk about this,
They don't get trained on that stuff at all. They don't get trained on those. They're not comfortable with those conversations. And what's interesting is from a medical standpoint, we're comfortable, like you being physician, me coming from senior housing and healthcare, we're comfortable with kind of those like conversations. Like, let's ask the questions.
Yes.
The
Yep.
financial people are really comfortable with the finance conversation, but they're never going to ask like what they consider the warm and fuzzy, like, I don't want to get too deep. That's not my lane, right? So part of my passion is training financial advisors to learn how to have these conversations and also to bring up your own personal story. That's why I share the story with my mom, because it also helps people realize, yes, I'm a financial professional, but I'm going through what you are going through right now. I went through it. So I can relate to you on multiple levels, right? So I think it's really important for financial professionals to kind of bridge that gap.
Yeah, absolutely. So speaking of that, let's talk. Can you share a little bit more about what did you go through with your mom? What
Yeah.
happened?
Yeah. So my mom was very medically complicated on paper, but she would walk around and she would seem fine. And so she had diabetes, she had congestive heart failure, she had bad knees, and she really didn't want to get her surgeries. I mean, I'm sure this sounds very familiar to a lot of adult daughters who are going through this with one of their parents, right? And if you ask the parent, they're fine. I'm fine. I'm doing great. I'm fine. I'm taking my medication. I'm fine. So unfortunately, she went in for orthopedic procedure and had some complications from that. And she had a pacemaker that she had some complications with that. And even though she came out of the hospital, she just was never quite the same, right? Could never really kind of get her physical ability back. Thankfully, her cognitive and mental ability came back. But it was just kind of the beginning of the downfall. So you had the underlying with the diabetes and the congestive heart failure, and it just kind of just got worse and worse. One thing I will say about my parents is they both had amazing careers. So from a financial standpoint, they had a great income. They had Social Security, they had pensions, back when pensions were great. And so we were able, and my parents had renovated their house so that my mom could live on one floor. So when things got complicated, they could bring in home care, she could live on one floor. But eventually it just got harder and harder and harder, right? And so there's this tipping point where, back to my comment about what are you most hopeful for, and I learned that from the partner I was working for when this happened. So I ask my families this all the time now. Mom, given where you are right now physically, like you just can't do the things you used to. Given where you are now, what do you want? I really want to stay home. Okay, great. We're going to do everything we can to keep you home. But if home is no longer option for whatever reason, we need a plan B. So that's how I approach it with families. Because if you think about it from a healthcare standpoint, when you're going through an emergency, everybody's telling you what you have to do, what you can't do, right? You can no longer do this. You have to stop eating meat. You can no longer do the steps. Mom, stop trying to do this for dad, whatever. So it's really important to step back and go, okay, based on where you are right now, what's most important to you? And then let them open up. Because it's the first time someone's asked them that question as opposed to telling them what they can and can't do or what they have to do, right? The other thing I think is really important in conversation is adult children, adult daughters have a lot of opinions, and they want to come in and they want to say, this is what we're going to do. So part of my role with families is also being the person that says, this is really not your plan, it's your parents' plan. You get to have input, and you obviously need to be heard, right? Being heard and understood is really important. Family meetings are very important. Financial advisors don't do family meetings. They talk to the one person whose account it is. Maybe the other spouse is sitting there, but they're not really participating. That's their traditional path. My traditional path is we're going to have a family meeting. Who needs to be involved in this? You know who people forget about? Best friends. Best friends also have opinions, right? So it's really important to hear what everybody has to say, but then focus on the person that has the diagnosis and what are they most hopeful for, and try to build around that where everybody can agree, like, okay, this is what we're going to try, and if not this, then that. And once you do that and you wrap in the healthcare conversation and the finance conversation, everybody can then focus on the most important thing, which is being a family member, loving each other, supporting each other the best way possible, and reducing the anxiety about, oh my God, how all is this going to cost? Because everybody has anxiety about how much everything's going to cost.
Yes, yes. So many great points I want to touch on. First and foremost, family meetings. Absolutely. So I start every initial conversation with, if we're going to be doing care planning, I need every single person that you care about whose input matters at this table. We're going to do a family meeting. And sometimes, I had a client that looked like it was the two parents and their 5 kids. We're doing it, right?
We're doing it.
Because I've seen the other side of it. I've been in the hospitals for a decade. I've seen when something happens to mom and they don't have an advance directive and they don't have their finances in play and they've never had a conversation about what are we going to do if something happens,
Right.
and there's no power of attorney. And now all of these kids are sitting there fighting and arguing and upset, and it's prolonging their mom's suffering,
Yep.
and it's tearing the siblings apart. And I've seen this play out over and over again in the hospital over the years, and it is such an important piece of, we're going to sit down and have a conversation with the entire family about
Yep.
what mom wants. And
Yep.
this is not about you, but your input matters. But we want to make sure that there's no he said, she said happening. We want to make sure everyone's in the same room, and you guys don't have to mediate anything because I'm there to mediate for you. Right. And a lot of times that external professional or provider coming in and just having that point blank conversation of like, what do you want in this situation, and being able to explain it makes a world of a difference with the whole family being on the same page, right?
Yeah.
So
Absolutely.
yeah, and so I love that you do family meetings because it is so imperative
Hmm.
that we're doing that, right? So family conversations is a big part, and I know that that's something that you really like to touch on.
Yes.
You mentioned something else, and now I'm trying to think about it because,
But you know what? I'm going to do a follow up to what you said, though. You made a very
yeah, go
important
for
point.
it.
You brought in the legal aspect of it. So one of the things I talk about a lot, and I got this from an attorney when I first started in the finance career. Like I heard an attorney say this, and this attorney that we work with here locally in Virginia. She calls it the three-legged stool, because when you're making decisions in these retirement years, you need to look at things from a legal perspective, a medical perspective, and a finance perspective. Like the three of them need to work together. And when you have all three, you have a stable three-legged stool, right? So this concept of, do you have your advance directives in place? That's a planning tool. And if you have them, you might have never communicated that to your kids, right? Having it is very important. The second step is communicating it to your family, right? Same thing with finances. Families in general don't talk about money, right? It's an uncomfortable conversation for a lot of people. Sometimes the parents don't want their kids in their business, either they have a lot of money and they don't want their kids to know, or they don't have any money and they don't want their kids to know, right? So they don't talk about money. But that's the same kind of thing. Like when you're in the middle of making a decision in a healthcare crisis, someone needs to understand what's going on with the finances, because you can't say we're going to keep mom at home with 24-hour care when you have absolutely no idea what mom's income is or asset level or any of that, right? So it all has to be tied together, the legal, the medical, and the financial. Because also in the medical, is it something that they're going to need care for a long period of time or a short period of time? So as a financial advisor, am I planning for 2 years or am I planning for 12 years? So the perfect example I give, someone's diagnosed with a form of dementia, right? We know dementia is an umbrella and there's all different types of dementia. If you're diagnosed with Lewy body, your life expectancy is shorter than someone that's possibly diagnosed with Alzheimer's. Or if you're diagnosed with Parkinson's, for example, you're going to live a life with Parkinson's. So understanding the medical condition is also very important from a financial planning perspective.
Yes, absolutely. 1000%. I feel like these family meetings also they just need to be interdisciplinary meetings with the
Yes.
family, of having someone who understands the medical aspect, a legal advisor, and a financial advisor all at the table together so that this can all be done, right? This is something that I work on here in Chicago is, I have my trusted referral partners of, okay, hey, I have this client. We need to figure out their legal situation and set up. They're generally elder law attorneys
Yep.
who specialize in estate planning
Yes.
and, trusts and wills and directives and like all of that stuff, right? But then the financial advisor is also at that table because they need to figure out, well, if they're advance directive is X, Y, and Z, and their estate plans are this, and this is their medical side, then this is how we need to plan for this, right?
Yep.
I mean, that
Yep.
is exactly what you just planned out. And we need more of these where there's everybody at the table, because right
Yep.
now it's so siloed. It's
Yes.
so incredibly siloed that, a family makes a plan with their financial advisor without even considering talking or thinking about their care needs. And then they go to their attorney and make their wills and their directives and all of this with no medical input. So they're kind of just basing it off of their own understanding of their own health. And then they go to their,
And they pick the
if they
wrong
have,
person as their POA. Like, so they pick their
yes,
husband who has dementia as their power of attorney. Like, no.
yes. The number of times I've had to ask people in their 80s or 70s, like, who is taking care of you at home or who is your support system? And their immediate response is their spouse. My first question is your spouse physically and cognitively able to support you?
Yep.
Because you have to understand that just because somebody has a power of attorney doesn't mean that it's a reliable or an appropriate power of attorney. And how do you better understand that? How do you know that? And then it gets into, I mean, I love that you brought up dementia, because dementia could be 2 years, it could be 15 years, and you
Right.
don't really know what you're signing up for. But if you have everybody on your team together, you can make a comprehensive plan for 2 years, 5 years, 10 years, 15 years, and see what that looks like. And in that process, if what happens when there's guardianship involved, because
Yes.
this person with dementia is going to lose capacity at some point, right? We know that.
Yeah.
So why don't we plan for that now versus when that starts to happen and then you don't know what they would want and they're no longer a reliable source of
Right.
information,
I
right?
think it's important for families to realize, and I'm glad you used the term elder law attorney, because there are families who did their documents in their 50s or in their 30s. And when you ask them at 75 or 80, like, oh, yeah, my documents are done, but they haven't updated them. So I'm always telling people, if someone gets a new diagnosis, your documents need to be updated. Like, that's a trigger point right there. Update the documents, and that your POA should be someone a generation below you. That would be ideal, right? I know you want your spouse, but your spouse is getting older as you're getting older. They're also going to have a more difficult time making these tough decisions. So sometimes having a generation below is actually the proper thing to do as far as supporting people in their 70s, 80s, and 90s. And why I tell clients as well that elder law attorneys are really the place to go. Estate planning attorneys or trusted will attorneys you might have gone to in your earlier years. But in your later years, if you're redoing, elder law attorneys are the ones that really understand the nuances of the power of attorney and then medical diagnosis and what if you have to go to the court for guardianship. Like, that's like their specialty. So I just wanted to go through that because some people might not be familiar with that term of elder law. But in my world, that is the team of attorneys that I work with our clients.
Yes. And for those who need it, they are also the experts in Medicaid planning for
Yes.
long-term care, right? So depending on your state, depending on what your eligibility requirements are or whatever, they are the experts in helping you figure that out if that is an option for you. So yes, elder law attorneys, huge plug for them.
Yeah.
Like you need them at the table, right? Yeah, so much of what we just said is like on repeat in my head
Yeah.
because
Yeah.
that's I feel like I'm repeating it over and over again to people, right? When you when you think about supporting these family caregivers and our aging adults today, especially I know you really like to focus on the solo agers.
Yes.
What do you see as the single most overlooked need?
Right. I love that. So let me define solo agers is a term that's used. So it can be someone who maybe was never married, no kids, or maybe they were married and it was the two of them, they didn't have kids and now they're a widow. Or it could also be somebody whose kids are nowhere close by. So we have a client who lives here. Her daughter lives in Europe. Her son lives in Asia. Yes, she has children, but they're nowhere nearby. She's considered a solo ager. So when you think about solo agers in general, most of them are planners because they have this fear of who am I going to call when something happens, right? Is it their neighbor? Is it their friend? They might have like a niece or nephew that lives out of state. And so they're constantly thinking, like, if I go to the hospital 911, who am I calling? So I have a passion for serving that population, and a lot of the people that I work with here do as well. Another hidden secret in the senior housing and healthcare world are called care managers, and sometimes they're called aging life care professionals. They are extremely helpful in so many cases, but especially in the solo ager case. So I call them the consultants of the industry. I also call them the adopt the daughters. Most of them are female. There are some male care managers and aging life care managers, but they are professionals that can be hired to kind of be your first point of contact. They can also help with medical appointments. They can help with transportation. They can help coordinate all things senior housing and healthcare, and also work with the financial professionals when the time comes that things need to be paid for. So if you are a solo ager and you are less able, the care manager, the financial professional, your legal documents, they're all tied together. It's a team. So building a professional team is really important for everyone. And it doesn't matter how much money you have, because you can build that professional team using local resources if you don't have the money to privately pay for those resources. Let me give you an example. Around the country, there are area agencies on aging. That's always a good place to start. And you can find, like, through your county or through your state, are there some kind of services that you can utilize to start building this professional team, right? So some people have the funds to private pay for them. Some people don't, but at least try to figure out where to start and do that. And the aging life care professionals, they are organized. They have a professional organization. They have their own website. If you look up aging life care, they're great. And they're a great place to make sure you're rounding out that team from a medical standpoint and coordinating the care so that the financial people know exactly what your money is supposed to do for you, right? So part of it is you're in the emergency. What do we do now in the short term to get everything organized? But more importantly, how are we going to sustain this in the long term? And that is the time in your life when bringing in professionals to help is really important. Even if you have children that are close by that say, mom's going to live with me or dad's going to live with me, or I don't have a job and I'm going to care for that person, that's fine too. And we know culturally, there are a lot of cultures who are like, my family is going to take care of me, full stop. Your family needs support. So your family may be the one to engage with the professionals to make sure that they are getting all the information, all the support they need in order to continue to support their parents, right? So I like to advocate that, like, I'm not about anybody who can help, but sometimes you just got to pay for the help in order to get the access to the care that you need and to have the outcomes that you're most hopeful for.
Yes. Again, so many great points. Care managers are my other speed dial out here as well. I have a bookmark to link to their directory for anybody who needs someone near them. They have a fantastic directory of providers. Some of you referred to them as consultants and adopted daughters. I just think they're angels. I mean, I think, they're on call 24/7. They're ready to jump in and help with anything, anywhere. You talk about solo agers. I had a client who was 85 years old, retiring for the first time in her life. Her daughters lived in two very different states, and she was a planner. She's like, I don't know. She had just had a hospitalization with a minor infection, but she was like concerned to me of what happens if something major happens. And so, we got right to it. We made a plan. We figured out, what she would want to do, who she's calling. And it's funny, we said this earlier, but she listed her friends, and I asked her, she said, part of the solo agers is, she said a lot of her friends had passed away in the past year or two. Right.
Yeah.
And so she had these few friends left, and she listed them as her emergency contacts. And I said, can I ask how old they are? Like, can I ask if they're in good health? And she's like, oh yeah, they're up there. They're in their 80s too. This one's almost 90. And I said, that might not be your best emergency contact.
Yeah.
Can we, I know you might not have somebody locally, but, let's include your daughter's numbers. Let's include, whoever else. And then I referred her to a care manager. I said, if your daughters can't get here in time, a local care manager can, and they can be the boots on the ground to liaise and inform your daughters on what's going on. They can talk to your doctors. They can talk to your financial advisor. They can talk to your attorney. They can talk, they would be the one who then can manage all of that versus you having to try and manage it, especially if you can't, right, in a situation. And so,
And I think with
great plug.
what I was going to say was that there are adult children who adamantly want their parents to move closer to them because they're concerned about them being by themselves. And that's a perfect example where when you can engage a care manager, the anxiety for the adult children that live far away can come down because then they know there's somebody close by. So I have a client who lives here, the daughter lives in Colorado, and the daughter was adamant, and this woman's husband had Parkinson's. The daughter was adamant that the two of them move to Colorado. So I'm talking to this client, and they're like, okay, well, I think we're going to move to Colorado. And I was like, can I just ask you, do you even want to move to Colorado? She was like, no, I don't want to move to Colorado. I'm like, okay, then we need to figure out how not to move to Colorado. And it was all about making the daughter feel comfortable that her parents were going to be okay because her husband all had his doctors here. He didn't want to switch doctors. All of those things that older adults think about that adult children don't think about, like uprooting from their medical support system is really important for older adults. So getting a care manager involved and talking about them moving out of their house and moving to a continuing care retirement community, that was enough for the daughter to go, okay, now I feel comfortable that you guys can stay in Virginia and not move, right? So sometimes it's just a matter of educating the adult children about what options are out there to keep their parents safe.
Right.
Yeah.
You with that though, you did bring up the cultural piece of it. And I'm in this same situation where, I'm adamantly moving my family out to be closer to me because, culturally there's an expectation that I'm going to take care of them. Well, I can't take care of them if I live 1,000 miles away. Right. So yes, I know what all the resources are. I know what all the supports I can set them up with are, but culturally the expectation is that I'm the one who's going to be doing that. Right. And so I need to make sure that they are nearby so that I don't have to jump on a plane every time something happens, right? And so I think there's two sides to this. I might have to disagree with you to a certain extent on that because I think for many people, yes, absolutely. I think if they are just aware and educated on what their options are, they'll feel a lot better about it and they can stay where they are. But when we're taking cultural considerations into context, I think
that trumps it.
Yeah, there's always an option. And that's not to say, once here, I think that is shifting with generations too, right? Like, okay, yes, I will help you out, but I'm going to engage all of these other professionals to help me help you, right? And that's what you were saying earlier.
Yeah.
It's about helping me. Something else you brought up earlier that I always ask in family meetings is in relation to families taking care of their parents or adult children taking care of their parents, the parents will write it down, right? They'll say, oh yeah, my kids will take care of it. I look right at the kids and I ask them right there, will you? Do you have the capacity to do this? Right?
Yes.
Do you have 3 young kids and a high demand job and you travel a lot for work? We're not putting you down as a responsible party for this, right?
Yeah. No.
Really
I
trying
have
to
stories.
Yeah, I'm sure. Do you want to share one?
Yeah, there's one I will never forget. It was the mom and dad lived together. Dad had dementia and was going to an adult daycare program. And they had 3 kids and they had a family business. And so the kids were all local running the family business. And I got involved and the daughter was the one who's like, we need help. And I'm like, okay, what's going on? And she's like, everybody thinks that I'm taking care of mom. And me and my husband are retiring to Florida. And they're not listening to me. I'm like, okay, here we go. So we had family meetings, we had financial things. We came up with a whole plan of how we were going to support dad, how we were going to support mom. And part of that plan was not her, right? It was, she's not going to be the person. And I remember talking to her like years later, like, hey, I just wanted to check in. It seems like everything's still good. And dad's, doing well. She's like, oh yeah. She's like, the best thing that happened was me and my husband retired. We moved to Florida. My dad had a fall and everybody was going, what are we going to do now? And she's like, oh, we already have a plan. Turn to page such and such. which didn't require her moving back to Virginia. So it's a real thing that a lot of families are going through, that the parents are just expecting kids to do something, or vice versa, the kids are just expecting their parents to do something. So it goes back to, you have to have the family conversation, and it's really important to have a third party lead that family conversation so that there's no family dynamics that are taking over during that discussion.
Yeah. Well, and I always say expectations is going to be the downfall of what happens with these family dynamics, right? You have to talk about them, and you have to put measures in place that are going to benefit everybody, and
Hmm.
not, put somebody else's life on hold for
Right.
this, right?
Yeah.
So really trying to write it down, have a plan. It's so important.
One
I
of the things
feel
I would say
like,
too, I'm sorry I'm jumping in,
yeah.
but I was thinking about what popped in my head just then was this concept of moving to retirement communities, right? That is another thing that I am constantly in conversations with families about. And think about it. Generations ago, people didn't move so far away from home. So there were people close by to kind of help. Now, families are spread out, couples are aging where they are, and some of them are choosing to move into the retirement communities, continuing care retirement communities, or life plan communities is what they're called. And they are the ones that typically have the financial structure of an entrance fee and then the monthly fee, right? And so I have clients who will say, I want to do this because then my kids don't have to worry about me, and I have access to care whenever I need it. To me, that's the number one thing. Access to care as you get older. You have everything in that system. But the children, or sometimes financial advisors who don't really understand the benefit, health, the care access benefit of moving to a place like that, are saying that's a bad financial decision because you're not owning and all of these things. So I really am an advocate for, you have to understand what the best options are given your specific circumstance, and let's build out the different scenarios. So if a scenario is stay home, if a scenario is move closer to your kid, a scenario is move to one of these retirement communities where your neighbor went to, let's map out all those scenarios from a cost perspective with some care needs assumptions in there. So that's where like a care manager can do an assessment, or I can read through physician notes or whatever and get an idea. And we come up with these different scenarios, and then you map the finances to each of those scenarios. So when you do that, you're helping people take everything out of their head, put it on paper, so that you can actually see, actually, this is not a bad financial decision. It can be a great financial decision in the long run, depending on what the circumstances are, right? So I always like to bring up this life plan because I had adult daughter, a soccer mom with me, whose years ago parents wanted to move into a local continuing care retirement community, and her sister were 100% against it. Like, we're here, we're local, we'll take care of them. I'm like, but your parents really want to do this, right? She's like, yes. And the grandparents would come to the soccer games, and they're like, we're moving. I'm like, okay. Years later, I bumped into the daughter at a store. Like, my kid had stopped playing soccer. I haven't seen this lady in forever. So she came up to me and she's like, I just want to thank you. I'm like, why? She's like, my father, they lived there for years. My father got sick. He ended up nursing care. He had all the care he needed. My mom had all the support from her friends there. It was the best decision they ever made. But at the time, she was adamant against it. So I was really thankful that I bumped into her and she was able to share that story. So I like sharing that story. Like, sometimes that is the right move. It just depends.
It is. I am all for CCRCs. I think when they're well done,
Yes.
like they have the right care options and supports and services, they are a wonderful option for most people. I will say I am starting to see a need for culture specific CCRCs, and we
Yes.
are very
Very.
behind in that process. People are they're starting to develop and they're starting to come up, but unfortunately they've been a huge disappointment from what I've seen as far as how unwell they are from a development standpoint, from resources to services to support to care options. So, this is my plug for developers who are developing CCRCs to really build good CCRC options for everybody and specific subset of communities, because it's already a crisis and it's only going to get worse.
Yeah, because people want to be with people like them. Like traditionally,
Hmm.
people who were in the military or State Department, people who traveled a lot, like they were the ones that we can be everywhere, anywhere, and it doesn't matter. But in general, people like to be with the people they want to be with, whatever that is, whatever that affinity group is. And so you're right. I think CCRCs are trying to be more cognizant of it, but trying to figure out how that model works in all cases has been complicated. I will tell you here locally, we had a woman, an African American woman who was in a sorority, and so it was her like thing. Like she would have her sorority meetings at the CCRC because she wanted more people of color to come in and see like you can live here too. And I have some Southern Asian clients that did the same thing at a new CCRC that's building, and I was speaking. And he came up to me. He goes, "Oh, we've got like 6 or 7 couples, and we're all going to move in together, right?" And I was like,
Hmm.
"That's how you get around something not being built ready, kind of create your own little network of people and say, hey, let's think about doing this together as a friend group, right?"
Right. I mean, it's similar to how older solo agers who are friends are choosing to now move in together, right?
Yep.
And live together.
Or live
It's
in
that
apartment
concept.
buildings where they're all like the same age.
Yeah,
Yeah.
exactly. And it's the concept of creating or living in a community that feels like your own,
Yes.
right?
Yep.
You share traditions, you share food, you share festivals and holidays. You want to be around people who celebrate and, more in the same things that you do. And so that aspect of community is so important.
Yeah.
I feel like when we've talked about all of this from like kind of initial phase to kind of end phase, many of our audience members, many of my clients, oftentimes when they're coming in, and probably for you too, they feel stuck at the I don't know where to start stage. They
Yeah.
feel overwhelmed with all the different options, all the different paperwork, all the different care options. What is the first step that you typically recommend that they can take today, tomorrow morning, tonight?
Yeah.
What is that first step?
The first step to me, the most important thing is educating yourself. So there are so many online webinars. There's local area agency on aging might have a speaker. I'm also big on disease specific. Like if you have a specific type of dementia or if you have a specific heart condition or a specific type of cancer, like it's really important to try to find that disease specific group that can talk the language and talk real world for you. So a lot of people are afraid to kind of jump up and talk to professionals because they don't know what questions to ask, they don't know where to start. So if you take the time to just go online and watch some webinars and start educating yourself, you'll see that you're not alone. There's a lot of people who are going through exactly what you're going through. There's a lot of resources to give you the education. And then more importantly, there's ways to connect with professionals that you're going to be able to talk with who understand what you're going through. I tell people all the time, like, families may be going through this maybe going through this for the first time, but the professionals that are supporting you have been going through this many times with many families, right?
Hmm.
So it's okay to approach somebody and say, I'm not sure exactly what I'm supposed to ask. That professional will help unwind the conversation and whatever you're locked up in, and they'll be able to help guide you. So using webinars, using support groups, using local organizations, I think are a very good first step, not just for the person with a diagnosis, not for their spouse, but also for their adult children.
Yeah. Yeah, absolutely. Education is key. Awareness is key. That's what we're trying to do with this
Right
show.
here, yeah.
It's the more you know, the better you are.
Hmm.
The better you stand when it comes to addressing any of this stuff. We
Yeah.
love a good practical tool or a tip. Do you have a very specific resource or a tip or a mindset shift that you wish every family or caregiver or aging service professional knew about?
Yeah. Okay. So I've already talked to care managers, which is one of my first ones. When I think about educating, I'm going to give it a plug for a gentleman here in Northern Virginia. His name is Steve Gurney, and he's been around for a long time, and he created Guide to Retirement Living, which is now called the Pro Aging Source Book. Yeah, Source Book. And he has spent his life trying to pull together information in one spot. So you can go to his website, Pro Aging, and he's got a website, lots of webinars, but he also has a hard copy book for a lot of the East Coast people. I think he's working on going west. But I've had people who live in California call me out of the blue because they stumbled upon a Steve Gurney webinar and heard about and wanted to call and ask me questions. So I would say that's one of the things that people outside of the DMV, Maryland, Virginia, DC, and maybe up to Pennsylvania, nobody outside of this area really knows that he exists unless you stumble upon it. So the Pro Aging Source Book, their webinars, really, really good. That's kind of a hidden secret for anybody and everybody.
Yeah, that's great. I'm going to have to check that out too. It's
He
awesome.
does a lot of disease specific stuff. He does a lot of like, not just for people who have an illness, but just like, how do you age well? You know, so even if you're in like your 60s and you're just like, I want to know how to age well, you know, he's got all kinds of stuff on that as well. That's a secret.
Yeah, that's awesome. That's awesome. So this last question is more of, relative to our current climate and environment around elder care.
Yeah.
So if you, based on everything you've seen and the work that you do, if you could wave a magic policy wand when it comes to family caregivers or aging or elder care, what systemic change would most improve the quality of life for these aging adults and their families and those who care for them?
Wow. Yeah. Say, growing up here in the Washington, D.C. area, my whole life, I have been around and watched policies come and go and policies come and go. So for me, passion, my two passions in the senior housing and healthcare space are hospice and dementia. And this answer is informed by that, because the one thing I would tell you about hospice services is they are covered by Medicare, Medicaid, and insurance. So when people are at end of life, so hospice is someone who has been diagnosed with something, meaning they possibly have 6 months or less to live, and families are wondering, how are we going to get those services? Those services are typically covered, right? And so when I worked in hospice, I felt like I could educate and provide, and we could take care of anybody and everybody. Now take that over to the dementia space. That is not the case, right? So unfortunately, a lot of services that people need who have been diagnosed with some kind of dementia, let's just say Alzheimer's, for example, a lot of the resources that they would benefit from are all private pay. And when you think about Medicaid, so Medicaid is a federal benefit that provides financial assistance, but it's run by the state. So people get confused, like Medicare is a federal benefit that you either qualify for or you don't. Medicaid comes across as a federal benefit, but it's run state to state, right? And so Medicaid in theory covers some home care, also will cover some long-term care services, mostly nursing homes for the most part. But if you're someone with dementia who is wandering out of your house and you need a secure unit to make sure you're safe and you don't end up on the news, your family wants to make sure you end up in the news, most likely that has to come out of pocket private pay. So that is my number one, if I could wave a wand, is that there was some kind of way to do a better job with Medicare, Medicaid, private insurance to make sure that families who are supporting loved ones through the dementia journey aren't left with everything out of pocket.
Yeah, that's such a big point you made. The reason why, I just want to dive into this for a second, the reason why a lot of the services for dementia are not covered under services similar to like hospice care is because most dementias don't have a predictable prognosis.
Right.
So hospice requires a determinate 6-month prognosis. The person has to be diagnosed with something that in 99.9% of cases, the person will pass away within 6 months.
Right.
Now with dementia, any dementia, there's no guarantee. Somebody could live 2 months, somebody could live 20 years. And there is no concrete process to understand a true prognosis in this situation until they're at the very end of their state life. And at that point, most people have figured out what they need and don't need and what they have access to. And so that is why there's such a discrepancy in traditional hospice care and then hospice when it comes to dementia.
Yeah. And people with dementia are the families that are supporting loved ones with any type of dementia are the ones that have the most anxiety about how are we going to do care, because it's typically a long point of time, right? Like those are the people that are really searching for support services because they know it's not like a short cancer diagnosis, or even with cancer, sometimes people get treatment and they're fine and they move on. But Dementia is going to be something that's progressively going to get worse. It's going to last a long time. They're going to need help. And there really is, there's just a lot of support that those families need.
Yeah. Yeah, absolutely. Before we wrap up, what is one takeaway that you hope every viewer walks away with after hearing your story and your thoughts and your
Yeah.
tips today?
The number one is family conversation, and don't be afraid to talk healthcare and finances. You cannot put your head in the ground and pretend like all of this is going to be okay. That's not how it works. And to your point, if you plan ahead, then your family doesn't have to worry, wonder, or disagree when something happens. What you don't want is the example that you gave of the emergency room when everyone's trying to figure it out. So planning ahead is what's best for everybody, and opening up about conversations and money and healthcare and what your wishes are is actually the way that you're going to do best by your family in the long run. And if you're a solo ager, it's the way you're going to do best by yourself, is planning so that if something happens, you know who your support system's going to be.
Yes, absolutely. 100% agree with you. Arvette, thank you again for being here with me today. The hour went by so fast. We could probably keep talking for
Yeah.
another hour. But thank you for the work that you do, and thank you for coming on the show.
Thank you so much for having me. This has been great.
Yes. For those tuning in live, thank you for joining us. I'll be back with another live stream in 2 weeks, same time, same place, and I will see you then. Take care.